Hi. Today I have a case story. It's a happy ending. I'm always a share happy ending story only, I guess, but this is very special. So she's 33 years old currently, and this couple been trying to get pregnant for last 10 years. We have a lot of patients coming for fertility challenge, and I have one patient, it's like a 13, and this patient is 10 years. So it's a long time because most of the times the people get drained out and then they lose their hope or they give up. But good thing they start early. So technically she started when she was 23. So now she's 33. So anyhow, she has a little bit of a other condition for like a challenging because the her like, irregular cycle. So she has a we call the PCOS presentation, polycystic ovarian syndrome, and when I'm looking at her quality of her like a menstrual like a blood, and she has very dark, and we usually call the blood stasis. Something's blocked, and then you're not doing regular every like a 28 or 30-day cycle, so it tended to be more clot like a clot forming. So we actually saw in her. So she had a previous two pregnancy, both miscarried, and also we see very frequently miscarriage with this PCOS patient. And the but she one was a natural pregnancy and another one was the IVF. So she actually failed her IVF. And IVF, it was a fifth week, the spontaneous abortion and the chemical pregnancy. So we see something here is that DNA quality issue. Even she's 33. So she's referred by her reproductive endocrinologist. So we are going to another IVF cycle prep with her. But she's very motivated, and the couple both in the medical field, like kind of medical field related, let's say. And so it means they have the tremendous stress in their life, like work wise, and that their schedule is just very irregular, and that creates them a little challenge for them, and I believe. So anyhow, so she came for acupuncture to support her IVF cycle. And then so what we can do for here, like let's say if a patient come and I've been trying for 10 years and I have the previous one failed and I'm now here. This one is we call a full force. We do everything we need. In her case, definitely acupuncture. And she was really dedicated. So she come like whatever we recommend to her, like 3 times a week, absolutely. And the Chinese herbs, absolutely. Like there's not much time left for her because she's between the IVF cycle. So we have a limited time, but she wanted to do everything she can do. And also we have something called like a embryo transfer day, like a pre and post transfer, like embryo transfer acupuncture. And so she came our clinic for just regular acupuncture and then herbology, and we actually had a good embryo. And day of transfer of embryo, I went there, and then she had acupuncture the same day and during the transfer. So what happened? She's now 16 weeks pregnant. It's actually excellent. Just waiting for 10 years is something. Definitely, I think this couple deserve to have this joy in their life. And but I wanted to emphasize about her case. So she had 10 years of this fertility. I always tell patient what's the most important thing to make this journey successful and then fast is a timing. So she had a good timing of a year. I mean, she even had a 30, like she's 33, still young age, and we did all out what we can do, and then just something we did right at this time. And I, as I said, this really it brought me so much joy, because I know some people want it for so long, and they deserve it because they waited and then their best, and then each time, and never, even she's like a pregnant, she's still coming like once a week. She want to make sure she has a good pregnancy, and then good labor same time. I think that's a excellent attitude to be the good parent. And I congratulate you, this patient, again. So if you have those challenges, as I said, the PCOS, and maybe a little bit of an egg quality issue, even the young age, it can be all done properly if we do in the right place. Okay, thank you for watching. Bye.